So again, my name is Dr. Miller. I'm one of the neuropsychologists here in the center. And I've given a couple talks in the past about the role of the neuropsychologist and what we do here in clinic. And what I'd like to talk about today is what the future might hold and how cognitive assessments might differ as we integrate technology in ways that we can leverage technology to understand more about brain and behavior relationships. I'll start by going through a brief history lesson on our current practices and what that entails, why this information is useful, and then what we currently do in practice. And from there, I'll go into talking about some of the things that I envision for our future as a field and how we might be able to change our practices to become more technologically advanced than what we currently do. Please feel free and interrupt and ask questions along the way. It's a lot more enjoyable if it's a dialogue as opposed to me just talking at you. You know, a lot of these things really reflect my ideas and aren't necessarily things that are in current practice, but they all, in my opinion, could be and should be. And so we'll kind of go through and talk about all of that. The reason that all of this is important is cognition, and particularly changes in cognition, are a defining feature of dementia and neurodegenerative disease. Pretty much all of the degenerative diseases that we see in clinic in some way or another influence cognition. And being able to detect those changes with a high degree of precision is critical both for clinical service provision as well as in research practices. And the way that we currently operate is we use what I call analog measures. And I promise you I did not coordinate my outfit with this picture from quite some time ago, but it just very happens to be that that's the same time. So a little bit of history in terms of the way that neuropsychology currently works. When a patient is referred to me by a physician, my role is to understand, has there been a significant change in cognitive functioning relative to their age peers? Is there a departure from normal? We anticipate and expect changes in thinking and memory as a normal part of the aging process. And we have a very good understanding of what the normal age-related changes are. And we do this through ongoing research by studying individuals at various points in the lifespan to know what is a normal pattern of behavior, what is a normal pattern of performance in the context of just aging. Sometimes those changes can happen sooner than we anticipate or more quickly than we anticipate, which is where the neuropsychologist comes in to try and identify not only measuring those changes, but understanding how those changes might be influencing the brain. And the way that we do that, I'll start by doing an interview with a patient to try and understand a little bit more about what the concerns are, what the changes are, the things that bother them, and how that influences their daily life. From that information, I will identify the changes in cognition that I think may be influencing those behavioral changes that the person's experiencing. I'll select a series of tests that can then be used to help me quantify those behaviors. We've got hundreds of tests available to us in neuropsychology, and each of these tests are specific to attention and memory and concentration and problem solving and processing speed, reasoning. And we know a lot about these tests and how well they work. And we've come to understand this through ongoing research. Many of these tests have been used for quite some time. I'll talk a little bit more about that. But through standardization and development of normative data, we know very well what kind of information we get when we administer these tests. But the critical limitation is that these are all what I call analog measures. You'll see this is an example of one of our frequently used measures. It's probably one of the most commonly used in the field. This is our current version, which was released not that long ago, and you'll notice that there's pencils and paper and books. None of this there's no technology in this. I literally have to have a technician go in and administer these tests using a clipboard and a stopwatch. It involves person-to-person contact. And there's no technology really in this, which seems a bit discrepant from our day-to-day lives when technology literally surrounds us. So a lot of the tests that we have, or at least the current concepts behind them, To be honest, many of them predate or are older than many of my patients. Some of the basic abilities and tasks that we use, both in clinic practice and in research, were developed prior to World War II, some even well before that. These tests were developed based on what's called a lesion model. And what I mean by that is by studying patients with changes in behavior, you look for a group of individuals who all manifest the same change. So for example, there was a clinician many years ago who identified a series of patients that all lost the ability to speak and generate fluent words. By looking at their brains collectively after they died, he was able to identify that there were similar changes in the brain in each individual. From that, we can infer that when there's damage to this part of the brain, it results in this change in behavior. Critical to that is being able to understand, is this change in behavior normal or is it not normal? And from there, this information was used to make inferences prior to the advent of MRI and CT scans. But we have all that available to us now. I don't need to look at my tests in most circumstances to identify when there's a structural change in the brain. I can get an MRI scan or a CT scan to give me that information. The other critical flaw with some of these tests is that they didn't account for what we now know is an integrated network of structures. The brain is made up of numerous components, and each one is specific to certain cognitive abilities. Some of them have an isolated ability that they're related to. Others are more diverse and have multiple roles. But the other component is that they're all connected. And this lesion model and the way that these tests were developed didn't account for that. So sometimes there can be change in behavior, but it's not because the cortical regions are damaged, it's because the connections are disrupted. And we can't currently disentangle very well with any one test whether or not it's a damage to the actual brain structure or the connections between them. And given the resources that we have available to us today, I'm not sure if we were starting from scratch and this field was emerging in today's society, I'm not sure that if this same approach, this lesion model, would be adopted. I think that we would probably do things a little bit differently. But because we have such rich history with all of these tests, again, we've got decades of research supporting their use, and so we know very well what kind of information we get. It's hard for us to make that change just to throw away all of the information and the research and science that we've gathered. But making that change, I think, is critical. And we're at a point in our field where we need to start making those changes. These current methods that we have, again, the technician, the pencil, the paper, it's very resource demanding, it's labor intensive, it's expensive, it's not very efficient. And in all honesty, we get a lot of good information, but we could get a whole lot more. And I'll talk in a little bit more detail about that in just a moment. My perspective is that as a field, we need to start thinking outside the box, and we need to be doing better at assessing cognition. One of the core limitations is that our assessment practices are restricted to you coming into the lab and me having an interaction with you at an isolated point in time. That doesn't necessarily tell me, though, how things are in the outside world. You know, behavior is a function of both cognitive ability, but also the environmental factors that surround an individual in their day-to-day life. When somebody comes into my lab, that's a very different environment than what they're typically operating in. The best, most salient example I can give is if you're having a conversation. You know, for example, right now, you are all very intently paying attention and focusing on the things that I'm sharing with you. But if there were something happening over here, say a music concert or something else happening, that would be very distracting, and you might miss some of the very valuable information you're getting from today's talk. That's a very simple example, but it's important because, again, what I get in my lab and in clinic and in a research study is a snapshot in time, but it doesn't account for the continuous behavior that occurs through all the days that you're not there in the lab. And that's important for us to understand. And in my opinion, if we integrate technology, we're going to be able to better capture that variability over time when you're outside the lab. So how can we do that? One of the simplest ways that we could think about it is incorporating technology by just digitizing our current tests. And a lot of the publishers are doing this. They're putting things onto tablets, they're putting things onto computers, and I think that there's a lot of benefit to this. It increases the precision that we can time things with. We can get more data about reaction time and decision making. We can create more sophisticated methods of presenting stimuli. There's a whole host of things that we could do differently. Maybe even alternatively, we could start doing assessments over the internet or via remote methods. And this could be tremendously helpful for our colleagues that are in other parts of the state that maybe don't have a neuropsychologist or a degenerative disease specialist in their community, because now I can increase my catchment area and start providing services to patients who don't have services available to them. So there's a lot of advantages to this, but again, it's still that snapshot in time. My argument is it may not necessarily be required that we do targeted assessments at all. And what do I mean by that? I mentioned a little bit a moment ago that what we currently do in clinic is an assessment. It's an active, it's intentional, and it's an explicit interaction where I am extracting behavior data from an individual during a specific point in time. And this is true whether we're doing it in clinic or in a research setting. But it doesn't account for how an individual's behavior changes over the course of their days, weeks, months, or in between all the times when they come into clinic. You know, another example is a lot of times I'll see a patient for a longitudinal study if we want to understand how somebody's memory changes in response to a new medication, for example. If they're coming in to see us and they're in a drug trial and we're looking to identify whether or not a new medication is helpful at preventing decline. Well, if somebody comes in at their first visit and we do an assessment then, and then they come back a year later after treatment, we look at their cognition again, and we compare time 1 to time 2, and we look for signals of change. But what about the other 364 days that happen in the interim? What if somebody comes in on a bad day when they come in for their follow-up? What if they got a bad night's sleep? What if they learned that there was a death in the family? Or what if that day is just not a good day for them? That might influence our understanding of whether or not this drug made a difference. What we need to start doing is capturing data, is how I refer to it. Everything we do on a daily basis it's human behavior, and all human behavior is a direct product of neurological functioning. There's things that in your everyday life, people are multitasking, people are making decisions, people are remembering things, they're problem solving. These are normal functions of human behavior that occur constantly throughout our day. If we could develop ways to automatically start capturing some of this information, that could be a huge benefit to our understanding of human behavior, because now we're starting to get samples over larger periods of time, as opposed to getting those snapshots. And the other thing is with those snapshots, we might miss. We might not time it correctly. We may not say, maybe the drug effect takes place at 13 months instead of 12 months. But if we only look at 12 months, we're going to miss 13, or if it takes place at 11 months. So by integrating some of these capture methods, we might be able to detect changes that we would have otherwise missed. There is so much information collected on you already via these passive data collection methods. If any of you have ever browsed the internet, which I'm guessing you probably have, you've probably found yourself shopping on a website and you're looking for a Christmas present. My thing is I'm a cyclist, so I spend a lot of time looking at different bike websites and retailers, and then I'll click on another site that I'm looking at, and now I'm reading some scientific articles, but the ads that pop up on the side are all about bike parts. Where is that coming from? Oh, it's because I was already looking at a bike site earlier in the day, so these advertising methods think that I'm interested in bikes. These methods, these direct marketing methods, are all driven by information gathered on you just by normal browsing the internet. You don't have to do anything. You don't even know that it's happening, but it is. And they're using it for marketing purposes, advertising purposes. And what they're doing is they're measuring your behavior, your interests automatically without your knowledge, and utilizing that in this context to get you to buy stuff. One of the most interesting and infamous examples is Target. Target developed, so they have a club or a rewards program where your expenses, you get coupons and things like that, and your shopping habits are tracked. Through monitoring and data mining, by looking at patterns of behavior and shopping characteristics, they were actually able to identify, and this is still remarkable to me, they were able to identify when a woman got pregnant, and they were able to estimate within a few weeks of the due date. And they were pretty accurate. And so what did they start doing with that information? Well, they started delivering timed advertisements. Around the due date, you'd start getting coupons and advertisements for formula and diapers and things like that to get you to buy more, because now you need these things. So that's an example of how this information can be particularly powerful and useful. I'll come back to that example in a little bit and talk about how it's critical that you think very carefully about how this information is utilized, because it's a sensitive subject, and I thoroughly appreciate that. And in this context, we're talking about shopping. But once we start talking about changes in brain functioning and behavior and neurological disease and illness, that's a whole nother layer of sensitivity that we need to be exceptionally considerate of as we're developing some of these methods. And I'll talk a little bit about that in a bit. These methods, these passive data collection methods, you can't do this manually. We know from just through very old research in the social psychology world, we know that simply observing a behavior changes it. Just by looking, just so if I were to ask you to interact with somebody and have a conversation with them, just you knowing, even subconsciously, that somebody is sitting with a clipboard recording what you do is going to change that behavior. That's no longer useful to me because it's not a reflection of your natural behavior. It has to be done passively without the awareness of the individual. I'll talk a little bit about some of the sensitivities around that in a bit. So how do we do this? Well, in my opinion, one of the easiest ways to do this is to integrate some of these portable and wearable technology. Mobile health research has exploded since 2007, and one of the leading areas of research, I think it's the number 3 of the spectrum of health. One of the number 3 related domain of mobile research has been in mental health, and utilizing these technologies to understand more about mental health functioning, mental health research, mental health interventions, etc. And again, so this has really exploded and exponentially increased since around 2007. Anybody know what happened in 2007? The iPhone was launched. So with that, right away, you see that, oh my gosh, there's a total possibility. There's a connection here. What if we were able to develop ways to not only record and capture and measure the ways that people interact with their technology and their devices, but then going back to that important critical component of standardization so we know what's normal, all of these behaviors could be collected. And my hunch is these probably already are. It's just they're not used for anything yet at this point except by the manufacturers to develop better methods for their products. But what if we were able to incorporate that data into understanding brain and behavior relationships? You know, typing speed, for example, spelling errors, reminders, alarms, how often you have to replace your reminder because you didn't do it the first time. All of these things could be measured and quantified in some way just by developing algorithms. Smartwatches are even more sophisticated because they've got the ability to integrate sensors. Pebbles and the little Fitbits are another example of ways that we could utilize technology to help gather more information about human behavior and the things that we engage in on a daily basis. You know, phones are probably the most obvious. You know, I mentioned a moment ago about typing speed, for example. Well, what if we were able to develop an algorithm that monitors how quickly you're typing, or how many spelling errors you make, or how long your phrases are? What if your phrases start getting shorter and shorter over time? Or what if you start omitting certain components of sentence structure? That could be informative because those types of language errors might give us clues that there's been a change in your brain, such as what we see in progressive aphasia syndromes. Or what if we start looking and seeing that you're making more mistakes with your right thumb than you are with your left thumb? Maybe that's suggestive that there's a problem in the brain on the left side of your brain. Maybe you've had a stroke. Similarly, what if we start using voice recognition technology to monitor utterances and look for pauses or word finding difficulties or speech that becomes slurred over time? All of these things could be valuable information that we're not able to measure or capture at this point in time. In research settings, there are some efforts that are going through that utilize an explicit active collection method by having an individual record their speech and analyze all of these different parameters, but none of it is done on a passive means. There's no way for us right now to take something like this and just capture everyday behaviors. The technology is there, we just need to merge the two so we get a better sense of how we can utilize this. And the goal with all of these things is to establish a baseline, an individual baseline. So right now, for example, I know with a pretty good familiarity what the average processing speed estimate is for an individual who's 65 years old with 12 years of education. But for any one given individual, I have to make an educated guess about what their processing speed would have been. Because at the end of the day, the critical component in dementia research, whether we're talking about Alzheimer's disease, Parkinson's disease, or anything else, the critical goal is when has there been a change from how that person has been historically functioning. I always have to make guesses about how to do that. But if I start using some of these methods and I start tracking somebody's typing speed over time, I'm going to know exactly where their baseline was because I have that data available to me. And now I can look for changes when there's been a departure. Even more sophisticated than that, maybe I could develop a prediction algorithm that could use a computer method to tell me automatically when there's been a change. And maybe it's the kind of thing that you get an alert on your phone that says, you know, maybe you should follow up with your physician, or has there been a change? Did you break your arm? Is that why your typing speed has slowed down? All of these things, by triggering this more active assessment to gather more information, could be integrated with these passive means to help us enrich the amount of information that we're collecting. But it's these establishing baselines are what are critical. Wrist devices, I mentioned smartwatches and things like that. A lot of these have the same features as a smartphone, but there's a huge added advantage with wrist devices is because they allow for skin contact. Already, the Apple Watch is capable of measuring heart rate, and there's efforts underway that are designed to start measuring pulse ox, how much oxygen saturation. There's even somebody I've heard that's trying to develop a method to measure blood sugars. What if we were on the strap, we start incorporating sensors that could tell us about galvanic skin response. Well, what is galvanic skin response? It's sort of a measure, a proxy of stress. So what if, for example, we start noticing that somebody's making more mistakes in their day-to-day functioning and it increases as a matter of stress? That's important information for me to get as a clinician because I know that when they're not stressed, they're doing just fine. But when they do get stressed, I can measure that and see what the influence of stress is on cognition. I know that that occurs, but I don't have any way to measure that because I don't have this type of information available to me. The other thing is accelerometers are what monitor movement of the device. They can look at tilt, they can look at acceleration and deceleration. Well, there's an accelerometer in our wrist in the Apple Watch. And what if I were able to detect when somebody starts to develop a tremor? And now what if I can, because I've got that baseline that I've been collecting and just kind of monitoring passively in the background for a few months or maybe even a year, I might now be able to intervene earlier because it's been detected earlier. Instead of somebody coming in after they've been shaking or having a subtle tremor for, say, 6 months, which is not that uncommon, people might start coming in sooner and getting treatment more earlier in the disease course. Another option too is, in Parkinson's disease syndromes, there's a notable phenomena where people stop swinging their arms as much. That's something else that we could monitor. Writing instruments. There's a smart pencil now by Apple, of course, Apple. And I have no vested interest in Apple, I promise you. I just like their products, and they're actually leading the way in a lot of these different sectors. They have a pencil now. And this pencil is capable of monitoring how hard you're pressing. It's capable of monitoring the angle that you're holding it. It's able to monitor how often you're pausing. We could develop ways to capture tremors. We could look at all of these informations. A lot of the tests that I do in clinic are pencil and paper. What if I start doing those tasks with the Apple Pencil? And now I can measure how long it takes somebody to find the next target, how long they pause at a given target. One of the tasks, for example, is you have to go from a number to a letter, and then the inverse is going from a letter to a number. What if I'm able to detect that somebody has a harder time going from a number to a letter than they do from a letter to a number? Maybe that information is useful. I don't know, because I don't have those data available to me right now. But so many of the things that we do require drawing and writing, and by capturing some of this information, we could enrich the information that we're collecting tenfold. And Pebbles and Fitbits right now, the things that track your steps, there's a lot of these different products available to us. And these are often used right now as a proxy for physical activity and exercise. We can use this information already just by tracking how many steps an individual takes, or how often they're active, how often they're sedentary, and try and understand how that influences their behavior. What if another example, I keep providing a number of examples reflective of Parkinson's disease, but what if we put one of these in the shoe or attached to a shoe, and we start looking for when somebody starts taking more steps, which might suggest that they're starting to shuffle their feet more. Again, the idea of detecting changes in behavior automatically sooner, with the idea of intervening sooner. The earlier we can intervene, the more likely we are to be able to provide benefit and help for these individuals. So these are all things that are currently available now. These are technology devices, and who knows what the future is going to hold, and who knows what's coming down the line. The rate at which technology is being developed is exponential, and who knows what's going to be coming down the line in the future. You know, another example that I was thinking about the other day is cars. You know, cars are becoming increasingly sophisticated to a level that I had never even imagined. I mean, self-driving cars are a reality. They're not that far off. But right now, we already have cars that have lane departure warnings, that have distance detection for how far you are in front of an object. Well, what if we could measure that and see, are you veering out of your lane more often than you used to? Maybe you're having difficulty perceiving the lines. Maybe there's problems with visual spatial judgment. Or maybe there's been a change in depth perception. If you're slamming on your brakes harder later, maybe you're stopping earlier. All of this information is stuff from normal everyday behavior that could be measured and quantified in some way. We just need to integrate the technology to do it, and then understand how those changes influence or are the result of brain functioning. Now thinking way outside the box. Video games are a fascinating phenomenon. I'm not a gamer. I don't really play a whole lot of video games, but a lot of kids do. Pretty much in my generation and every generation after that, video games are a ubiquitous part of growing up. All of the current games on the market, in one way or another, involve cognitive functioning. They involve things like attention, sustained attention, processing speed, problem solving, planning, memory. All of these behaviors could be captured, quantified, measured, standardized in some way. This is a screenshot of a game called Guitar Hero. Anybody know this game or have grandchildren or children who play this game? Guitar Hero, so what happens here is this is a screen, and each of these ones at the bottom here reflects a button on a device. And you'll see there's 5 buttons. And what happens is these discs start coming down, and you have to push. So when this button gets to the bottom, you have to push the button that corresponds with that color, and then this color, and then this color, and then this one, and then this one, and sometimes more than one at a time. And these start coming down faster and more of them at the same time, and it gets harder and harder and harder. This requires processing speed, this requires attention, this requires manual dexterity. I could very easily develop a task that is identical to this, that takes information and looks and increases the speed or decreases the speed at which these stimuli are coming down until I know where that individual's ability is. Same thing with errors. If I have an individual who's making mistakes on this task when there's 2 or 3 targets, but they don't make any mistakes when there's only 1, that's very important information. And I could look to see, how does this performance compare to any other kid their age, or even an adult their age? Now the thing is a lot of adults today are like, well, I don't play video games. Well, that's true. But the kids today, when they're older adults, video games are gonna be a normal part of their existence. They're gonna think, oh yeah, this is a game, I can do this. Another one here, Angry Birds. This is one, I do play Angry Birds. This is a test where you have to, basically you have a little catapult and you have to draw back the bird and you have to set the angle at which you launch the bird, and how far you pull back tells you how far and how fast the bird is going to go. And the goal is to knock down these objects and smash the little piggies. That task there, that game requires visual spatial perception. It requires angular judgment. It requires some degree of depth perception, as well as a little bit of planning and a little bit of organization. Again, all of this could be standardized, measured, and quantified so that I can understand cognition as a function of just playing an individual game. Tetris is one of my favorite examples. This is a mental rotation task where blocks fall like a puzzle and you have to put them together to make solid lines. When you make a solid line, they disappear and more blocks fall. It gets faster and faster as it goes. You can adjust the speed. But the other thing is it tells you what's coming next. And you could utilize that information to help you plan ahead. And I could then measure that, how effective somebody is at planning ahead if you give them a goal. And there could be a fixed solution. And all I have to do is figure out ways to measure that. And because these are all done on a computer, that information is incredibly easy to record. I just need to figure out ways to start aggregating it and collecting it. So is anybody doing this already? Absolutely. Anybody hear of the game Sea Hero Quest? Sea Hero Quest, this is fascinating to me. Sea Hero Quest is an app, it's a tablet-based game for phones and for, I believe it's on Android now as well. And what this is it's a game. And if you didn't know any better, all you would think is that it's a game. There's a couple different tasks. There's one where you have to navigate through a maze. There's another one where you have to shoot a flare back at a target after it shows you the overhead view. So you have to remember where in space the target is, and you have to be able to shoot a target, something back to hit the target. And then there's another feature where you have to chase different monsters, and it records processing speed and how quickly you can navigate through an alley that's moving quickly. Unless you knew exactly what the task was, you would have no clue what type of information is being collected on you, because it looks like a game. I'll show you a screenshot in a minute. You would have to have very first-hand knowledge, whether that be a neuroscientist or a neuropsychologist or a cognitive or behavioral neurologist, to understand exactly the type of information that's important, because otherwise it looks just like a game. All of these data through normal gameplay are being collected and aggregated and stored and used for research. These are collected on people just normal. Anybody can go and download the game and anybody can play it. It's free, doesn't cost anything. And all of these individuals are normal individuals. And why would we want normal individuals? Well, remember, we have to understand normal before we can understand abnormal. And if I think about, well, okay, I've got, in those pencil and paper tests I showed you in the beginning, my normal data, I've got about 2,000 people. And that's collected by the test publisher. And in neuropsychology world, 2,000 people is considered massive. I mean, that might as well be the whole global population. The game was launched earlier this year. As of the beginning of this month, over 2 million people have downloaded this game. I don't know how many of those 2 million people are continuing to play on an ongoing basis. But even if we had a percentage of that, that dwarfs my current normative sample. And thinking back to video games, there's an online network for PlayStation, there's an online network called Steam, there's an online network for Xbox. The aggregate combined user base of all three of those online systems is about 200 million people. Think for a moment, if I now have data on, again, 1% of that, 0.5% of that, we're talking about a sample of information that is unparalleled in any other cognitive or neuroscience research. I mean, that dwarfs the Human Genome Project and everything else. It's staggering. The advantage of this, one of the claims that the authors make from this test is that 2 minutes of gameplay is equal, you get the amount of information that would take about 5 hours of in-person time in the lab to collect. Let's say that's an overestimate. Let's say that it's actually 1 hour. Still, I'll gladly do 2 minutes of research if I can collect information that equals about 1 hour of time in the lab. Just think for a moment about how much more quickly the science would advance and develop if we start leveraging these more often into our research practices. If we get the same amount of information in 2 minutes that once took us 5 hours, the rate that research and development would accelerate is exponential. And because of that, we're going to learn more, we're going to learn things more quickly, we're going to be able to identify things earlier and understand changes with a higher degree of precision than we ever thought possible with our current methods. This is what the game looks like. Again, I have no affiliation with this game, but it shows you a map, and the goal is you start here, and then it tells you have to go from the first flag to the second flag to the third flag. And then once you've done looking at the map, obviously you have to memorize this. It takes the map away, and then this is your little boat that you have to steer, and then you have to remember where to go. Over time, it records how quickly it takes you to go from one target to the next. It records the errors you make and how many times you go into a different pattern or a different area. And if we start looking at tens of thousands of people who perform the same thing, we can see very clearly where people go, where people make mistakes, how often people bump into things. All of this information is recorded. This is obviously not the same level, but this information is substantially richer than what I could possibly collect doing this with a pencil and paper task. I could never get this information from a pencil and paper task. I think that this is one of the most novel things that I've seen in dementia research. It's been met with a lot of skepticism. I will be very upfront about that. And there's some issues with this. It's not perfect. But I'll tell you what, they certainly are thinking outside the box, and they're really doing wonders with this. And we need more of this because this shows that this can work. This clearly shows that these types of methods can absolutely work. So why do we need, what have been some of the problems? Why haven't we done this already? There's a lot more resistance in the neuropsychology community for these methods and changing than really what there is from general public and other aspects of the scientific community. We neuropsychologists, we like what we're doing and very slow to adopt and change. There's a whole host of arguments on the scientific side, but from a user standpoint, two of the main arguments that have been presented are the idea of technophobia and, of course, Big Brother and being watched. Both of these are semi-legitimate. The technophobia one, I think I've touched on a little bit already. A lot of people have worries. There's a couple things that I currently do on the computer, and as soon as I pull out the computer, I'm often met with, wow, I'm not so good with computers, or computers don't work well with me, or I have a hard time with computers. And for a lot of individuals, that's true. But this is getting to the point where it's kind of an irrelevant argument for a lot of individuals, and in 10 years, this is going to be completely non-existent. In fact, what I worry about more is that the inverse is going to be actually true. If I bring it in 20 years from now, if I bring a patient into clinic and they come into me and I break out a clipboard and a pencil and paper and say, draw this for me, they're going to look at me like, what are you talking? It's going to be like being tested in a foreign language to them. I have a nephew. He's actually a college freshman now. He has never had a physical textbook. He has never had a physical textbook. All of his course materials, all of his assignments, all of his everything from classes, all done on an iPad. Everything. He no longer has a backpack because he just has an iPad. So for him, if I bring him into clinic and say, here's this pencil and paper, excuse me? Where's the computer? Where's the tablet? So this, to me, this technophobia idea, I think is somewhat legitimate at this point, but eventually it's no longer going to be relevant. In fact, more worrisome is that the opposite will be true. Of course, Big Brother is watching. There's a lot more credibility to this, and this is a very serious concern that I think is critical to be mindful of as these are being developed. It has to be a central component from the ground up. Security, privacy are, of course, absolutely critical. Nobody wants to have their information leaked. Nobody wants their information out there without their permission, and that's absolutely critical. And one possibility, some people might not be comfortable with the idea that there's data being collected on their behaviors without them knowing. Well, of course, informed consent would be required. These aren't the kinds of things that would just be done without your permission or without your knowledge. There would have to be some procedure by which you opt in and say, yes, I'm okay with this and I agree to that. But even beyond that, maybe we need to kind of update that and kind of keep tabs and make sure that you're still okay with this as time goes on. But then the other component is, well, what do you do with this information? Do we want just anybody going in and looking at it? I don't think that that is necessarily the best way to do it either. Maybe one possibility.
Tammy? Elko?
Yes.
We can hear your conversation.
Sorry, the girl's in the office. I'll turn off the speaker.
Thank you.
So maybe this is the kind of thing where the information, you provide some consent to to collect the information, but maybe there has to be an additional consent or permission to actually go in and look for it. You know, so maybe it's the type of situation where I know that you've agreed to participate in a program where these behaviors are monitored and collected, but nobody can look at it until you give me permission, and I have to actively go in and say, okay, I want to pull out this information. Because again, the idea is to take this information and get historical patterns of behavior that can enrich the information that I get in my clinical assessments. So maybe that's another possibility. Maybe there's a way that we could tier participation so that people are provided with options. Maybe it's the kind of thing where you agree to have your data collected, but you don't really want it used for medical purposes. Maybe you just want to contribute to the research data anonymously. Or maybe it's the kind of thing where you say, okay, I'm willing to have this information and make it available to my physicians with my permission. Or maybe it's the kind of thing like, you know what, I want the computer to do everything, and I want the computer to tell me if it detects a problem, I want to know. So maybe there's a different ways that we could think about how these information are used and accessed, but there's no question that data security and privacy are paramount in this. There's a lot of things that still need to be addressed. And one of those things I talked a little bit about is privacy. Another big thing is identity. How do I know that the information that I'm collecting from an individual is from who I think it is? That's an important piece of information. You know, with a phone, the iPhone, for example, and I think some of the Samsung phones that don't catch on fire have a thumbprint reader on them. So that I know who that person is when they access it. But that's not true for computers, for PlayStations, for watches. So we have to come up with ways to be able to ensure the identity of the person that we think we're collecting data from is actually the individual we want data from. We also have to make sure that these methods are reliable. If I have a thermometer that gives me a different reading each time I use it, that thing is useless. Same thing applies here. If I'm getting information that varies constantly, that doesn't give me the same information, that there's no reliability, I can't use that. Now, we expect normal variability, but I would expect there to be some degree of reliability in similar circumstances, because if a test isn't reliable, it's not going to give me valid information that's going to be meaningful. Other components that are critical is thinking about how do we link these behaviors to brain functioning. You know, so for example, if going back to my Guitar Hero game, just because somebody does poorly or starts having difficulty with a sustained attention like that, I don't know necessarily right now what that means in terms of changes in neurological functioning. And that would be a critical component of future research. We'd have to study that, both in healthy individuals as well as individuals who are suffering from diseases. And then the other critical component is thinking about, of course, how this information is used. I mentioned earlier the Target ad, where they are able to develop ways to detect when a woman is pregnant and start delivering targeted advertisements and marketing materials. Well, one day, this actually happened. A man stormed into his local Target, furious that the store was sending his 16-year-old daughter advertisements for diapers and formula. And furious, are you suggesting that my daughter get pregnant? Oh, well, it turns out that a conversation needed to be had between dad and daughter. Kind of broke the news on that one. So, whoops. So Target was right, but the way that they used the information wasn't very carefully thought about. And that's critical here. So, for example, I don't want to create an algorithm that predicts or that is able to identify when somebody has a stroke based on their changes in speech pattern. I don't want to go have a pop-up come on your phone and be like, hey, I think you had a stroke. That's probably not going to be very helpful. So we need to think very carefully about how we use this information, because we don't want to go around freaking people out. So what does Target do now? They still do this. Make no mistake about it. They still do it. They're a little bit sneakier, though, about their advertisements. So now, in addition to giving you advertisements with baby formula and diapers, there might be a wine glass next to it, or a lawnmower. So things that don't readily go together, but they still come. Make no mistake about that. And Target is not the only retailer who does this. What does the future hold? I don't know. Again, all of these things that we've talked about today are based on available technology, things that we could implement now. But I have no idea what's coming down the line. I have no idea what's being developed. You know, there's virtual reality glasses that are being developed. There are a number of things in the works right now. There's a neuropsychologist in Texas who does a lot of work with virtual environments. And what he's done is, you know, for example, I don't know how an individual on my tests, when they do poorly on some of our tests, I don't know how that really interferes with their daily life. And what if they're having problems shopping? Well, this guy has created a way to utilize virtual reality goggles to create a target that you actually CVS, that you actually navigate through in a virtual reality environment, and you're given several tasks. And so the psychologist can actually observe how an individual operates in a virtual shopping environment to identify exactly where the problem is. So let's say, for example, a patient goes to the store and they say, oh, they never come back with any of the things that they were supposed to buy. They come back with a bunch of extra stuff. Well, why? Is it because they're forgetting their list? Is it because they're having a hard time finding things in the store? Is it because they're getting lost in the store and freaking out and leaving? Is it because they don't have enough money? They don't know how to count change? There's so many things that could go wrong, but I don't have any way to assess that now. But if I use virtual reality environments, maybe I could. Nobody knows where things are going, but I have a whole lot of hope and faith that things are going to change and that we're going to start doing a lot more of this. I personally think that some of this stuff is the coolest things that neuropsychology and neurodegenerative disease research and dementia research. There's so much potential here. And I'm kind of excited to see where things go in the future. It's something that is pretty interesting to me, and hopefully things continue to develop. But until then, it's kind of a big mystery and an unknown. The other part of the problem I have is convincing my colleagues that it's actually the right science to do. Thank you very much for your time and attention. I'm happy to answer any questions if you have them, or go from there. And I'm not late. I'm on time.
I was thinking, targeting even a specific behavior like aggressive behavior, and being able to look at that and monitor that and improve ways to assess that, because we deal with aggressive behaviors very primitively now.
Absolutely.
We, call the ambulance. We inject them with a bunch of meds, or give them a bunch of meds, and then call the ambulance.
Or we shoot them and kill them.
Yeah, and so it would be nice to take something like this and to assess those behaviors as they are, developing or getting more and more aggressive. To
Absolutely.
actually do something about it instead of how we handle it right now.
Absolutely, and along those lines, a lot of times. So I used to work in an inpatient brain injury unit, and aggressive behaviors is a very common phenomenon there when you're dealing with patients who have brain injuries. And what we used to do and this is probably still common practice, is when you encounter a patient who has a reliable habit of aggressive behaviors or agitation, which is also common in the populations that we see here, the job at that point is to identify what are the antecedents or triggers for that behavior and what are the consequences of that behavior. So what leads up to the individual committing that act of aggression or agitation, and what happens afterwards? Because those are the things that you can manipulate. And if you start to manipulate those things, you can influence the behavior. But if you can't identify what those are, there's no way that you can intervene. So right now it's very labor intensive. You have to have an individual come in, and so as a psychologist, I used to have to go down into the unit, and I'd have to sit in the corner of a gym and watch a patient for 2 hours, 3 hours.
Yeah.
That's 2 or 3 hours where I'm helping this individual, but nobody else. And so if I were able to if I had mechanisms or tools available to me that allowed that to happen automatically, I could then say, oh, hey, look at that. That's what's causing this behavior. You know, one of the other examples too is in cardiology. If you've ever had it's called a Holter monitor, where they monitor remotely continuously over time what your heart rate is and what your pulse is doing. That's the kind of information. You don't have to sit in a cardiologist's office for 3 days to have them monitor your heart rate. You don't have somebody with a stethoscope and taking your blood pressure. It's done automatically. So these are the kinds of things that we need to start integrating and thinking about.
Well, AI is already doing that. So I'm thinking about your aggressive patients. AI could, like a watch or something, could monitor their behavior, and then for, I don't know, a couple of days or something, and then they could modify the antecedents of the aggressive behavior and reward them and give them a reward that automatically makes a change in their brain chemistry. And so it gets better and better because they get rewarded and then their behavior gets better.
Well,
the AI keeps learning and
exactly.
rewards.
So one of my areas of interest in terms of research, it's tangentially related to some of the technology integration, is predicting behaviors and predicting outcomes and algorithms. And there's a whole paradigm that artificial intelligence is based off of called machine learning. And what this is if you identify a set of parameters that are associated with a particular outcome, the computer will actually teach itself what are the factors that are most strongly associated and are associated with the highest probability of an outcome. All of these methods could be readily integrated. Because the thing is they require massive amounts of information and data, things that we don't currently have available to us. But if we started using some of these technology methods, we could have that information and develop those behaviors. So again, going back to those predictive algorithms that I mentioned, detecting when there's been a change in typing speed or a change in speech patterns, all of these things could be studied, quantified, and applied to these machine learning principles. Thank you.
I'm creeped out by, because I'm kind of a privacy nut, because they're already gathering, if you're on the internet, it's already collecting all your keystrokes. So,
Again, that's why.
I should, maybe you're saying that I should get used to it.
Well, there's some truth in that as well, but at the same time, it's a valid point. It's a critical component of all of these things that need to be thought of in exquisite detail, and we need to incorporate people from information science, from informatics and data security, computer science, and user groups and consumers, because these are critical things to think of. And what bothers you might not bother somebody else, and what bothers
I seem
me.
to be bothered, but other people.
And also to bring the data down to something that's actually usable and important, because now it's happening to specialists and doctors and whatnot. In my field too, there's just massive amounts of data that they're now expecting you to sort of pour through and figure out.
So I would actually offer a counter argument to that.
What to do with like all this extra data.
I would offer a counter argument to that in that I want more data, and I want a computer to sift through that for me.
Right.
So I agree with you that there's a tremendous amount of information, but that's a good thing.
Now sometimes there's like if I look at the VA, just just,
Yep.
you know, tons of
Oh,
data.
yeah, in the
And
VA
you're like
especially.
going, oh my goodness, you know.
What do you do with all this? And
I
it's
have
and
all
then
this data.
yep. But if you had a computer program that
Right.
you were able to say, well, this is what I need to know,
Right.
and it went through and sifted through everything else automatically, maybe that addresses the problem. And the more data, and so coming back to the idea of predictive algorithms and modeling and things like that, the more data you have, the more accurate your recommendations are. So that's why I say that more data is generally better, as long as you don't have to manually go through it.
Right.
So
You couldn't manually go through.
No.
it. That's why we have computers.
that's true. That is true.
Sometimes now as a healthcare worker, you have to go through a lot of this.
Yep.
data, and it takes a lot of time.
Yep, and it's labor intensive, it's
Yeah.
resource
Or
demanding,
there's
it's
tons of
subjective,
data,
there's
yeah.
all kinds of things to it.
Wow, great.
Thank
That's
you.
really, really